This is Brent of the Brookbush Institute, and in this video I'm going to show you guys the shoulder abduction test for cervical radiculopathy. I'm going to have my friend Yvette come out. She's going to help me demonstrate. This is a fairly simple test, but it's a test that I think has transference to things you guys might see in the individual's daily activity. So I want you to keep your eyes out for this one. Here's how this works. Somebody comes in with cervical radiculopathy signs. So maybe on our subjective exam, Yvette was complaining about some right-sided neck pain. Maybe she has some tingling type stuff, maybe some cramping in one of her arm muscles, right? Like, you know how like sometimes cervical radiculopathy patients get that like unremitting like fatigue feeling, right? And she's getting some tingling in her fingertips, right? So we know some nerve involvement is happening, and we know the neck's involved because that's where like she's got like this pretty harsh pain. The test itself goes like this. Hey, in this position, any change in your symptoms? No. So you still feel all the stuff? Mm-hmm. Okay, that's unfortunate. Do me a favor, if you do this, how does that feel? Better. That feels better. Okay, that's a positive test. That's it. That's it. This is the shoulder abduction test. Not a complicated test, a specific test though. So if you get a positive, research shows that actually that's a pretty good indicator that we have cervical radiculopathy. Not very sensitive, so don't give much weight to the no, but let's do that one more time and think about this for a second. Right, can you do that one more time for me? So can you guys kind of imagine, right, if we do this, she just took a bunch of tension off her brachial plexus. She probably took some tension off a couple of the nerves in her arm, right? Just by kind of bending at the elbow, going into a little bit of elevation at the scapula. The rest of this is all in a nice relaxed position, right? So if I take some tension off these nerves, you guys can imagine how symptoms should go down, right? Now here's what I was talking about with keeping in mind with daily activity. How many people have you seen walk in to the clinic, or maybe just even around a restaurant or even at home, and the first thing they want to do when they sit down is what? Right? So if somebody comes in with neck pain and their first position they want to get into when they try to relax is this, guys, I would think in the back of your head, wow, that could be a cervical radiculopathy sign. And guys, I'm not saying catastrophize this. That doesn't mean that everybody who relaxes like this has cervical problems. That is not what I'm saying at all. But if someone comes into your clinic with neck pain and you were not thinking cervical radiculopathy before, maybe seeing somebody do this as their relaxation position is a good indicator for you to do your cervical radiculopathy cluster, right? So that we do get a good indication of whether that is the diagnosis that we're working with, because that might change the way we treat just a little bit. All right, so again, just a quick review, super easy. You're gonna assess the patient's symptoms in sitting and try to be consistent about the way you sit. Like I would make Yvette sit with pretty decent posture here. I wouldn't let her slouch. And then I would ask her how her symptoms are in this position. If she's a fairly irritable cervical radiculopathy, she has some pretty good symptoms, we're still pretty acute with this, chances are just sitting here is gonna be a little rough. All right? And then all I'm gonna have her do, hey, do me a favor, Yvette, can you just put your hand on top of your head? Right? So I'm unweighting some of the nerves, unstretching some of the nerves from brachial plexus on down, and if she goes, hey, does that help at all? Mm-hmm. And that helps her symptoms. And right, be careful with the question you ask. The symptoms you were talking about when you walked in, right? Yes. Right, so this is the right-sided neck pain, is that better? Mm-hmm. Yeah, it is, yeah, and then the nerve stuff is a little better? Yeah. Right, so that's a positive. If her symptoms go down, that's a positive. Guys, if you have any questions about this test, this very easy test, please leave me a comment in the box below, and I'll talk with you guys again soon.